Good morning, everyone. Our webinar will be starting shortly. Please look at the screen if you can, and we will be having some live polling options during today's webinar. And if you have your cell phone, that would be great. You can send a text to 22333 and put in the subject line COVID-19 Heroes, and you'll be all set up for our word doodle or word cloud along with our polling function. So the webinar will be starting shortly. Thanks for joining today's COVID-19 Session 4 Sustaining Workforce webinar series hosted by Health Choice Network and Alliance Chicago. We'll be starting in a few minutes. Just wanted to make sure everyone's aware that we are forever grateful for our community healthcare heroes, and that's you. Thanks for being on the front line of the COVID pandemic. We'll be starting shortly. To participate in today's live polling function, take out your cell phone and in the to line, put in 22333, and in the subject line or the message line, put in COVID-19 Heroes, and you'll receive a response back, and then it'll be all set up to participate in our word cloud along with our polling function that we'll have throughout today's webinar. And today's question that you can put into the polling function on your phone is, in one word, share what rocks about your health center's workforce. Today's webinar is all about the community health center workforce. We'll be starting the webinar in about 4 to 7 minutes. Welcome to today's webinar, Preparing Communities for COVID-19. We're starting in just a few minutes. We want to make sure that everyone is aware that you'll participate, hopefully, in today's interaction using your cell phone. Please text the number 22333, and in the subject or message line, put in COVID-19 Heroes, and then you'll be able to participate in our word cloud along with our polling function. The webinar will be starting in a few minutes. You can take out your cell phone and type in 22333 in the to line, and then in the message line, type in COVID-19 Heroes. You'll receive a response back, and then you'll be participating in our live polling function along with our word cloud. And today, for our webinar, we have one question. If you could name one word that rocks about your healthcare workforce, what is that one word? Type in that one word into your phone on that 2233 number, and we will get going. The webinar is starting in just a few minutes. We'll be starting the webinar in just a few minutes. Please get out your cell phone, and in just a few slides, you'll see on the screen your ability to sign in to our interactive polling function for today's webinar. Good morning, everyone. For today's webinar with our live polling function, we'd like to hear from you. So if you could take out your cell phone and type in the to line 22333, and in the message line, type in COVID-19 Heroes. You'll receive a response back, and then you're all set up to participate in a live interactive polling and word doodle. And today's word cloud question is that you can type in one word, share what rocks about your health center workforce, as today's webinar is all about workforce. You can type that in throughout today's webinar, which we're going to start right now. So as you can see, we're getting more and more responses for today's word cloud, and it's all about workforce. So good morning, everybody. We're going to start today's webinar on preparing communities for COVID-19. This is our 4th webinar series, and today's topic is sustaining our community health center workforce. These webinar series have been put on by Health Choice Network and Alliance Chicago, two nationally known health center controlled networks, and hopefully you are participants in one of our national networks. For today's agenda, we're going to walk through some high-level items. Then we're going to hear from one of our 2 CEOs on the national support for community health centers, Dr. Fred Rockman at Alliance Chicago. Then we will go into a deep dive into our community health centers workforce. We're going to highlight 4 federally qualified community health centers from across the country, each of them giving their experience on sustaining their workforce at their health center through this challenging COVID period. Then we will hear from our partners at the National Association of Community Health Centers and Coleman Associates, talking to us about some resources that are available to us at our federally qualified community health center dealing with sustaining our workforce. Then, as always, we'll have some polling functions, some feedback, and of course, our word cloud of the day. So again, my name is Dr. Tim Long, and I'm happy to turn it over to my colleague, Dr. Fred Rockman, who's going to talk to us from a national level how Alliance Chicago and also Health Choice Network are helping to support all of our health centers within our networks. Dr. Rockman, are you with us? We'll give it 1 minute and we'll hear from Dr. Rockman. And for the others, if you are not on mute, I would strongly recommend putting your phone or audio on mute. We do have some background.
Dr. Long, can you hear me now?
Yes, Dr. Rockman.
Great, thank you. So on behalf of Alex and the Health Choice Network team and the Alliance team, I'd like to welcome everyone to this week's COVID-19 webinar. This week, we're focusing on workforce. I think everyone is looking forward to the opportunity to compare notes, share challenges and solutions, and generally strengthen the spirit of camaraderie and collaboration that are such an essential part of the community health experience. We're all learning so fast. This week, I want to highlight an emergent opportunity, funding opportunity that's available from the FCC. I hope everyone's aware of the $200 million just made available to support telehealth infrastructure. And this funding is available to health centers and consortium of health centers. The COVID-19 telehealth program provides immediate support to responding to the COVID-19 pandemic by funding telecommunication services, information services, and devices necessary to provide critical connected care. This is the opportunity for us to move beyond the immediate tools and approaches that we've cobbled together to move to a more enduring and comprehensive technology and ability to support approaches to future-oriented virtual and telehealth services. It's been less than a week from the funding announcement to opening of the application, and funding is first come, first served. So it's really critical that we respond immediately. Health Choice and Alliance are partnering to support your applications in two ways. The first is providing research and detailed information needed to complete a viable application as an individual health center. You should be receiving or have received an email by midday today outlining and containing all that information. The second way is for health centers that feel unable to apply on their own on this timeline. We're offering to assemble consortium applications. This funding would be virtually passed through to the participating centers, but we would be able to do the heavy lifting of the application process. In both instances, the networks are partnering to support your implementation, to provide access to group purchasing and infrastructure, and leveraging other funding available to support that implementation phase. Again, since the funds are limited, it's urgent that you respond immediately. Please let us know how to help. So with that, let me transfer it back over to Dr. Long to get us going.
Great. Thank you very much, Dr. Rockman, for those words. And Alex Ramillo, the CEO of Health Choice Network, did want to participate today. Unfortunately, he had been urgently working on another project, and he gives us full support also. So as we turn to our federally qualified community health centers, we're going to hear from 4 health centers. The first health center is Community Health Centers of Pinellas. Dr. Kelly, are you with us?
Yes, I am here. Good morning, everybody, or wherever you're at. I guess everybody's probably still morning. All right, so we were asked to talk about sustaining our workforce during this COVID-19 pandemic, and I'm going to share just a few slides with you, and I'm sure we're all facing very similar challenges and struggles, and probably have all done very similar things in order to maintain our workforce and keep as many employees employed as possible. So we're just going to go through a few things briefly. First of all, we identified that there were definitely some challenges. As soon as the pandemic started to roll through our area, we very quickly noticed that people no longer wanted to come to the office. We had about a 65% decrease in our traditional patient visits overall to pre-COVID numbers, and a greater decrease, of course, with dental visits. Very early on, we also postponed all non-emergent surgeries and procedures. Our schools and universities closed and went to virtual settings as the rest of the country. And we continued to see an increased prevalence of COVID in the community, which made people more and more concerned to come out of their homes, rightly so. So we had to make staffing changes. If you'll switch to the next slide, I think we're ready for that. So first we kind of looked at the organization, and initially we just separated teams. So anybody that was working in common workspaces, we tried to get them some social distancing, and then realized that we needed to increase that a bit. And so we looked at who could work from home or other remote areas. So we looked at all the staff, and they determined who was able to work at home and who needed to continue to come in. That included things like our virtual call center, case management, referrals department, a lot of the administrative staff, and others we allowed to come, excuse me, allowed to go to home to work. And as well, we're converted as many appointments as feasibly possible into a telehealth or teledentistry capacity. Next slide, please. And we also looked at what people could do alternatively in their same work environment, but not needing to work in their current capacity. So we moved MAs to the call center. We were experiencing an extreme number of people just calling and asking questions, and our call center staff were not trained to be able to answer a lot of those questions. So we moved MAs into the call center to be able to help field some of those questions appropriately. We also moved MAs to the front office to work as screeners. We're now doing temperature screening and risk site-based screening at each entry into all of our buildings, not only for patients, but also for staff and any employees or visitors. Our dental hygienists are now doing asynchronous teledentistry visits. So they are in with the patient, and they can use a video camera to examine the teeth and take x-rays, which then the dentist can review remotely and make treatment plans. We also came up with alternative strategies to try to keep some schedules as full as possible. And so we realized quickly that telehealth was going to be really the main thing to kind of help fill in the schedule and also still provide care for the community. And so we made some outreach calling to certain kinds of disease processes, such as I'm a pediatrician, so we called all of our ADHD patients that were due for medication checks, anybody with asthma that had been seen in the last 6 to 12 months, and we just called to check on them and see if they needed any medications and to talk to them. We also looked at workforce planning, duties and responsibilities that could be allocated to alternative assignments. We evaluated our staffing ratios and tried to project need for the future. Next slide, please. Next slide. Oh, there we go. All right. And then, of course, employees get sick, and that affects your workforce probably more dramatically sometimes than other things. And also, we had to deal with the fact that some of our employees were unable to come to work, not necessarily due to illness, but due to caring for children or others. Very early on, we were able to locate childcare facilities in the area that would accept our employees' children and be able to still remain open. So childcare has not been one of our main reasons for our workforce to be out, luckily, but illness certainly has been. So, you know, as with any time, we allow our sick employees take time off. If they're not ill but in quarantine or isolation, we're allowing them to work remotely if the job allows. And then we return them to the office based on the CDC guidelines and state regulations. So if they're out due to COVID screening, then we keep them out for the 14 days that the CDC says, or until their COVID test is negative and they feel well enough to return if they're ill for another reason. Of course, if COVID positive, then we follow that guidance as well. And as far as travel, you know, in the state of Florida, the governor has made some travel restrictions and regulations which do tend to change from day to day. So we've been just following the executive orders regarding to employees traveling outside of the state as to how long they have to self-quarantine in order to return back to work. And currently what we're doing for our providers is we're trying to do an alternating provider schedule, whereby for 2 weeks you perform one duty, and then the following 2 weeks you perform a different duty, which is really just kind of a rotation between telehealth and in the office. We tried to do that to keep potential risk down. So if you're exposed to somebody in the office, then you know, you should have 2 weeks of telehealth coming up that you could still continue to perform some duties from the safety of your home. We also changed some of our clinical operations. So we consolidated some of the health centers and hours. We created 3 pediatric wellness centers, so we have 13 locations total. So we took 3 of those locations and designated them for well children only. We realized quite early on that families were scared to come out, but yet some of our vulnerable young infants still needed vaccines and physical exams. So we made those well centers only. If anybody in the family is ill, we route them to another office. We consolidated Saturday hours again because people were not wanting to leave their home, and we now have dedicated telehealth hours on Saturdays. And we had to consolidate our dental centers due to executive order from the governor, who suspended all but emergency dental issues. And as with all others, I'm sure, we've increased communication with our employees, and we're doing a variety of things now to try to help keep people informed of the changing times. Our CEO, Elodie, does a weekly email communication to the entire staff. We do weekly Zoom meetings with all of the providers on Thursday afternoons, and the emergency response team has daily meetings. We did have to do some suspension of a few of our service lines, such as our chiropractors. We suspended their services, and our osteomanipulative professionals, we suspended their activities as well. And we converted to telehealth everything else that we could, such as our behavioral health services, our nutritionists, and others, our pharmacy, or clinical pharmacists and things. We are now doing curbside pharmacy delivery, again, trying to keep unnecessary foot traffic out of the centers. As I mentioned, we added telehealth on Saturdays, and we have drive-through COVID-19 testing at 3 of our largest centers, which has been a game changer in the ability to keep suspected patients out of the office, which mitigates your employee risk exposure and helps dramatically when you talk about positive cases and needing to isolate potential exposures afterwards. So that has helped tremendously with maintaining workforce in the office. And I believe that is the end of my slides. So thank you for asking us to speak.
Great, thank you very much, Dr. Kelly. We truly appreciate all the work that you are doing at your health center and your care team. So it's fantastic, and thank you for taking this opportunity to letting us hear from your health center. So as we advance the slides, and I want to apologize, we do have a little bit of a delay on the slide advancement. So for those speakers saying advance the slide, just know it's a few seconds, about 5 to 7 seconds. So here we're going to take an interactive polling. It's our first poll of the day, and hopefully you have your cell phone with you and you've done the setup of the polling, putting in 22333 and then healthcare COVID-19 heroes. And the first question is, has your health center had any COVID positive employees? And in there you can respond A, which is yes, or B, which is no. And we'll give it a minute as we see the live results coming in for all of the respondents on today's webinar. So again, has your health center had any COVID positive employees? We'll give it another 5 to 7 seconds, and we'll then see what the final results of our interactive polling on COVID positive employees is. Okay, let's close the poll now, and we will stick with this percentage here. But 57% of health centers have said yes, or 58 have had COVID positive employees, to about 42% have not yet had any COVID positive employees, and we hopefully, with social distancing, we will not have any more. So thank you for participating in our first interactive poll. And now we're going to move on to our second health center, and we are welcome to invite Comwell Health and CEO Pamela Tripp. Pam, are you with us today?
I sure am, Dr. Long, and it's I'm very pleased to be with you today. This is an exciting topic and one that's very dear to my heart. I want to talk a little bit about colleagues and the importance they are in our organizations. And I've always said that our colleagues are our greatest stakeholders by far, and they are our greatest assets. And it's important at this time that we do take time to discuss how we are working with our colleagues and how we are helping them to be the frontline soldiers in this pandemic. And they truly are. You know, many times we talk about, celebrities and people who are getting all these kind of awards, but when you get right down to it, it is our healthcare colleagues throughout our nation that go to work each and every day to make a difference in people's lives. And I don't think there's any more greater heroes than them. But it's so important that we all practice the O2 principle, and that is putting the oxygen mask on our colleagues before they put it on the patient, so they're able to put it on the patient. So investing in them is important. And I think it's important, just a few words before we get into it. I think it's important that we realize that investing our time, energy, and effort, money, whatever, into our colleagues in non-pandemic times, non-natural disaster times, will give us that high reliability, that agility that we need when the really tough times come, the external forces come in on our organizations. It is at that time where that payoff will come back. You know, we've all seen some videos that are not so pleasing, you know, healthcare workers talking about their workplaces and how dissatisfied and upset they are. And that's not what we want as leaders of healthcare today. So, but it does take that investment of time, energy, and effort all along throughout the normal so-called days in order to get the result of that collaboration and teamwork and commitment and knowing that you truly care about them and what they do each and every day. So it's very important that we communicate in the multiple ways in our community health centers during so-called normal times, but I think during a really natural disaster or a pandemic, we have to really amp that up quite a bit. And from what I'm hearing, that's being done at many community health centers, that's being recognized. And so this first slide, if you want to move to, I don't know if
advanced slide.
Yeah, advance that slide if it's going. Maybe a little delayed again. But one of the first slides I have here is talking about just the different ways that we're amping up our communication. And we realize that that can't be every week. It has to be daily, that we need a high-touch daily communication and transparency to all our colleagues so they feel well informed, they feel taken care of, and that there is a true back and forth communication about what the needs are and are we addressing those in a timely manner. So where we have removed a lot of the standing committees, you know, quality committee and environment of the care and performance improvement, corporate compliance or whatever, we have kept some of those in place, such as our primary care team meetings with all our providers 2 times a month. And lead provider meetings. We have lead providers in medical, dental, behavioral health, and they are with me, and that's happening every month. But beyond that, there is a definite 24-hour cycle of multiple communications that are all linked together that allow us to continue to listen to what our colleagues are saying on the front line and then respond in a timely manner. So I'm going to let, I have 2 of my dynamos here, Tammy Dunn, who is the COO, and Tiffany Horn, who is Director of Nursing and over Infection Control. I've been teasing us lately about being the TIF, TAM, TRIP trio. So I had to throw that in there. But I'm going to let them explain a little bit more about that importance of communication and cycling and, you know, and that ground up swell that we need to make sure we're addressing as we go through these challenging times.
Right. This is Tammy. And as Pam was talking about, we really felt like in the very beginning communication was going to be key because people were scared, people were nervous, employees were asking a lot of questions. So we had to really kind of put together our task force, which we called our COVID task force. And we were very strategic in who we put on that task force based on strengths because we really needed some powerhouses to be able to take this COVID task force and push it through the organization. We decided on our Senior Director of IT, Allison, definitely needed her for the IT portion of this. Karen, our VP of Quality, Karen Smith, Tiffany Horn, who's here with us today, Director of Nursing and Infection Control, Tammy Collins, who is our Senior Director of Risk Management, and myself got together and formed this task force, and we were overseen with SLT, who was involved in every section of this every day. And in addition to our daily communication that we do on an everyday basis, where you have your emails and you have your newsletters that go out and your daily huddles first thing in the morning, we decided to section out our region and get one of our task force members to be over each region. And we felt like that with communication with our practice managers was going to truly, truly help to get the information out and to get the information in. So we decided to, our slides that you see on the screen right now will start off with a morning and what that huddle looks like, and then we're going to work our way through. So this is our 24-hour cycle every single day of what we do for communication with our staff and with leadership. Tiffany's going to take the first one.
Okay, so every morning we start off with our providers and our clinical support staff, and we just go from the ground up. What do our staff have questions about on that day? What concerns do they have? They talk with their practice managers and their directors in multiple counties, whoever is at that site, and they give those feedback and those questions, and then we take those questions to our noon meeting with the task force. So boots on the ground staff are first, and then we roll it into the noon meeting, Tammy.
Okay. And Stephanie, if you go back one slide, we're still on that first slide. So the regional COVID task force, we decided the best time for us to meet was at lunch. So we took our lunch, and that is where we're able to talk about our meetings that we have with our practice managers. So after the morning huddle at 8 o'clock, where the practice managers talk with providers and clinical support, then it goes to the regional directors, and they talk with the practice managers. And they're talking about anything that day that could be an issue, a problem, if we have any call-outs, any colleague issues, in addition to any colleagues that are having some family problems with, we did have some colleagues that had family in New York City that were going through some really hard times, not being able to see sick family members. And as leadership, I think we need to know that so that we know what our own employees are going through. Any equipment needs, any questions that we got from staff. So that was that first touch point with the regional COVID task force member. And then at lunch, just the COVID team met, and we discussed any issues from the site and started trying to resolve those and getting equipment ordered or sent to that actual area. And then after that meeting, senior leadership, all the VPs and CEO, we get together and talk about any other executive orders that might come through, the CDC guidelines changing. Because in the very beginning, we had a lot of changes. Every day it was something different coming in from another organization that we had to change policies, and get that communication out. So it also kept the SLT group in contact with what's going on in the organization and any employee issues or anything that we needed to get. And then we move over to at the end of the day.
So at the end of the day at 3 o'clock, I bring all the practice managers together for a daily huddle and a daily call. And in that meeting, a lot of times Pam will join that meeting with us, but the senior leadership team is also in there. And this gives the practice managers an opportunity to have their questions answered and to be able to circle back to the colleagues the next morning and provide answers to the questions that they had that same day. We do this meeting by virtual Zoom. It's where that we can address any needs. Our supply management coordinator is also available in those meetings. And we ask every day, what needs do you have? What are your PPE needs? And in that way, our supply manager can find out what they need. And in the morning, she will courier those to the clinics that need. So it's a 24-hour turnaround. Whenever we meet in 3 o'clock in the afternoon, the colleagues or the staff have their questions answered by the next morning, and they have the supplies that they need. So it's a very fast turnaround time. No one is worried about what's going on, and all information is disseminated at that meeting time. So now, Pam, if you want to talk about the communication with the furloughed staff.
Yes, and so we've talked a little bit about how we're engaging and keeping everybody in the loop, feeding them, a lot of information, and then the Eagle Tweet goes out every day. That is our newsletter. I think and when we go through, the same as when we went through the hurricane situation with Florence, when we have the Eagle tweet that goes out every week, but when we go into these disasters or these really unusual situations, it goes out every day. So we're at number 27, I saw yesterday, Eagle tweet. And so what they're not hearing maybe in all these conversations, they're hearing about where we're at with our application for the Paycheck Protection Program, or we're applying for FCC telehealth. And then we're also putting things in there that will uplift their spirits, give them things for their kids to do. I have learned to enjoy the San Diego Zoo quite a bit. CAMS, I highly recommend that. So it's important that we give some, bring some inspiration and some hope and joy into their lives. We've even been making up here a big thing is the Hope and Unity big red bows, and I'm making red bows for our locations to hang out, but in front of their offices and stuff. But anything we can do to lighten up the days. But here again, we got to talk about all of our colleagues. We got to talk about those who we had to lay off, those that we had to reduce hours. And, we have a very large dental program, and we laid off in one fell swoop about 55 people. It was very difficult to see that happen based on the ADA recommendations. And we are doing only emergent care at this time. So we actually, before they left, we got everybody's email address and said personal email address, because they were not in Citrix anymore. We would not be using them through the inside the Citrix software. So what we did was we got their home address emails, and the director of our dental program emails them, or and checks on them and tells them what's going on and has that. Also, we have a service excellence manager, cultural manager, and she is actually calling them at home one by one and saying, "Hey, how are you doing? Just thinking about you." We've kept the word going out about our Paycheck Protection Program, where that's at, because that would directly affect them. We have done everything we can to keep them as connected as possible. At senior leadership, we're putting together cards, and we're all signing it, just saying, "Missing you," because it's very isolating, and all of a sudden you've had your livelihood inside an organization, and we spend more time with the people we work with than we do our families, and all of a sudden they're just kind of casted out. And so anyway, it's important that, of course, we have Facebook pages and things like that, but it's important that we do not forget those who are not with us that would be returning back. So just wanted to tell you a few ways that we're reaching out to those who are unemployed.
Next slide.
Okay, so how do we keep our healthy community and our healthy workforce? So very early on in the beginning, we started with the Lunch and Learns, really when COVID was still in China and we were unsure how this was going to affect North Carolina. I started going through and calling the health departments to see what their plan was, and I quickly realized that the health departments were relying on the community health centers, and that they were going to be sending us these patients, which really made me think about, what do we need to do? So we started going through our PPE. We got an inventory of that, and we started distribution of where that needed to go so that we could keep a handle on how much we had. I looked at our cleaning supplies to make sure that we were going to be able to disinfect our areas appropriately. And then early on, we also started screening patients at the front door. We would take their temperatures. Any patients that had a cough, we put a mask on those patients. And we did the same thing with our colleagues, just to do daily monitoring of our colleagues to make sure that they were not sick. And if we did have a colleague that was sick, then they immediately were sent home. Fortunately, we have not had any colleagues that we have had to send home due to sickness. We have had a colleague or two that we sent home just because they were exposed, and we wanted to make sure that they were cared for appropriately. But as soon as those patient test results came back negative, and the providers or the colleagues had no symptoms, they were brought back to work. And in some evolving cases, we've been able to send one provider home on telehealth, so she didn't miss anything. And also very early on, one key thing that we did for Commonwealth Health was we made a COVID helpline. Our patients were able to call in. They were able to be directed appropriately based on their signs and symptoms, and if they needed swabs, we were able to accommodate that as well. And now we have evolved into telehealth, and we are also looking at migrant health and how we are going to look at our H2A workers that are going to be coming in and how we're going to take care of them and provide the resources that they need, not only to themselves, but to the farmers out there that are caring for these farm workers. So we are evolving quickly on how to keep our community healthy as well as our colleagues.
Okay. Next slide. And on the operations side, as with most every other community health center that's been out there, and even the last webinar we saw, there's no way to put everything on a slide of everything that you're doing, but I feel like everybody's kind of on the same line of changes that they've made. We definitely are on telehealth and telehealth visits. We started out by doing that from the office where people were able to still come to the office, but provide that telehealth service to the patient. And we're evolving now and getting our providers into a rotation schedule where they can telehealth from home. And we have one provider at each site to stay just for emergencies, because you never know what knocks on your door at a community health center. Next phase, we're going to be working on our nursing, our nurses and our translators and our front desk staff to look about trying to get them as well being able to be on tele and be able to work from home. So those are things that we're looking at and that we're currently working on now to get that happening. We are still seeing our OB patients until last trimester on telehealth, and then last trimester they are coming in and being screened prior to. We have our WIC department at home doing telehealth there. Pediatrics, we are still doing 5 years old and under for well child visits here in the clinic, and it's a different entrance and one at a time that comes in. We do telehealth sick visits, and then they're scheduled an appointment time to come in the afternoon if a pediatrician needs to see them. And our positive life patients as well are being done via telehealth and come in as deemed necessary by the provider. Positive life is our HIV population, for those who might not know. I listed out there just logistic operations for other sites to see if they were interested about the different things that we have. The GSA, who is our front desk, we call them guest service associates, the nursing responsibilities and provider responsibilities. I think everybody's a little bit different maybe in how they're handling it, but as an organization, I can say with the changes that we made, we really felt like telehealth, didn't realize telehealth was going to be as good as it is, being that we went from a 25% no-show rate to 0% in some of our departments, like behavioral health. They actually increased in their encounters, only working half a day. And they decreased the no-show rate to zero. It's unbelievable. Now that people are staying home, I guess they're going to answer the phone and do telehealth face-to-face versus getting up and coming to the office. So we were very excited to see that the no-show rates have decreased and patients are. I would say the only challenge is when we first started, I think with providers not being able to have that one-on-one and being able to physically see a patient and do a physical exam, they were a little apprehensive. But since we've gotten going on telehealth, now they absolutely love it and they don't want to go away from it now. They want it involved, even in the future. So we're excited about the telehealth part of it. I'm going to turn it over to Pam and let her say any final comments.
I think that's it for us. I appreciate the opportunity, and I'm excited about learning from the rest of our speakers today.
Great. Thank you so much, Pam and team. What a great presentation. We really appreciate all the work that you're doing at Commonwealth, North Carolina. It's appreciated. So I just want to let everyone know that on the GoToWebinar, on the right-hand side, there's a panel that you can expand. And today's slides are in the handout section there. There actually are 5 handouts that you can download and save. Please share those slides with anyone that you would like to. We also have the frequently asked questions from last week's webinar, webinar number 3 on telehealth. And we have a couple of other piece of information and documents on the handout section for some speakers who are coming up. So I'm honored to introduce our next community health center, Howard Brown Health Center in Chicago. And I'd like to turn it over to Dr. Holberg and my colleague, Kristen Keglevitz. Howard Brown, are you with us?
Yes, we are. Thank you so much, Tim. I appreciate it. I'm going to go ahead and get started here, and then I'll turn it over to Dr. Holberg. So thanks for having us today. We're happy, so excited to hear what other health centers are doing, and just really excited to present today. And I wanted to start out here. So we sort of began to think about what our guiding principles were, especially when we were thinking as an HR team and as a leadership team, so that we could, as we made decisions, could kind of hold those to these principles. And so I wanted to share those here, that the first and foremost was to protect our health, safety, and made a commitment to the economic security of staff during the crisis. We've really been led by Dr. Holberg and our two regional medical directors, Dr. Maya Green, Dr. Patrick Gibbons, in making sure that science was at the center of decisions we made, as well as what we were doing operationally. We immediately moved to having staff. We kind of created a chart that helped us with tiering of staff that in the very beginning put the workforce to work at home that could, and then sort of made a decision about a week after that, when this right before the stay-at-home order came out in Illinois, to then move to more staffing that was working from home. We also have an employee health department with a nurse that staffs our employee health, and we added one of our physicians to centralize all of our employee health issues. So any staff that were exhibiting symptoms, whether they have their primary care at our health center or they have their primary care externally, wanted to make sure that was centralized so that we could have good communication between employee health and HR on making sure that we were supporting people as well. And then we also operate 3 retail stores, so we're unique in that way. And our biggest issue was trying to figure out how do we protect pay for workers, and making sure that we were really thinking about all of the different workers of our 500 plus staff that we have. One of our members on the HR team who has a great knack for coaching and training. We done a series of sort of manager support webinars in really getting our 80 plus managers to really have the tools, as much of the tools in their hands to support and guide employees. And in changing to this stay-at-home working environment has been a shift for most of them, since that, as most of us, is not what we're used to. We also had an additional, we were grateful enough financially to this point have not laid off any staff, and that's including our retail stores, and instead began to think about how to utilize those staff to help with things like delivery of goods to the different clinics. We're starting a food delivery to patients starting this coming week, and utilizing other staff that were sort of put on what we call paid furlough, where they didn't have the same work they were doing, so in the stores or administratively, but kept them with full and whole paychecks, and then are starting to redeploy them in the last couple weeks as well as the coming weeks. We also created a couple new pay code accounts in our system. One of the things that was really important to us was that in the midst of COVID, that people who were exhibiting symptoms of COVID, if they were assessed by employee health, that they were not using their PTO. So we added additional paid time off code that basically had that if they had that assessment done, then they were getting what we call sort of a public health initiative, that we were telling them to quarantine, and then they are not to use their PTO in those cases. They're getting full pay above that. Next slide. We've been doing weekly kind of manager meetups and expectations. We also really talked to our managers about how important it was to deploy them to support and guide employees, continuing to repeat our employee health kind of metrics and kind of ways that they want to be involved. We also took the CDC guidance on employees that met the criteria that usually would work in the clinic, and making sure that those employees were not kind of on the front lines to protect their own health. And so they also are getting kind of an official remote assignment location. And that's where we've moved a lot of people to telehealth in those cases, or to other work that they could be doing to help support the agency. And you can go to the next slide. We've also been doing a series of things to keep the staff engaged. So just like the other health center mentioned, we do a twice-a-day operational call where our clinical leadership of each site, our nursing leadership, and our operational practice management does a twice-a-day operational call. We start the day with an 8:30 a.m. call. We focus on things like, what do our swab counts look like for today for testing? What is our PPE? What does staffing look like for today? And are we having issues with different sites having staff issues or shortages? And then we end the day at 5 o'clock with another operational Zoom call where we sort of recap the day. Did any questions come up, action items from the day before, challenges, new sites or new testing that we might be opening. And we also centralize our dental team, and the dental hygienists are responsible for PPE. That's been really helpful because we did not have central supply before that, and that has helped us with keeping PPE at the different sites the right amount, as well as making sure people know how to don and doff the equipment. We also have an intranet that has helped us a lot with policies and procedures and kind of having that be the go-to. And then Dr. Holberg and her staff began to rotate staff for 2 weeks at a time between clinic work and telehealth just to preserve the energy of the workforce. We also are doing twice a week all staff meetings. So David, our CEO, and myself and Magda have been running the agendas for those. We do a clinical update once a week. We do programmatic and operational. They're 45-minute Zoom calls where we have had invitation to all staff. We've been getting at least 300 plus of our staff to attend those. We also began to reimburse employees who were working from home for cell phone and home internet expenses to help with some of those costs they didn't have before. Provided the essential worker documentation letter. We really had our development department work on sort of reaching out to our donors, and we are having currently a daily lunch delivery to our staff working in health centers. That's box lunches. We've also been trying for some of our staff, like call center, that we can't operate remotely because of the way our call center is set up. Our MAs wanted to really take away any barriers. So people who had taken public transportation, since we're in such an urban area, trying to encourage them, if they are having issues getting to work, that we will provide rideshare assistance to them through Uber or Lyft. And then we've been doing a lot of trainings on how to manage remote employees. Next slide. And then one of the things that we have been, we have a parent and caregiver working group already that had been working and had put a series of things in place the last year, our first ever parent caregiver time off from work policy. And we really have sent out a communication just to acknowledge that those that are doing their work from home and doing parenting and school, homeschooling, been sending around kind of a communication around flexible work schedules for those working at home. Also working on emergency childcare resources and helping people access those that the city and state are offering to help people sort of get to work when that may be a challenge. When we think about sort of our goals, we want to make sure that we're testing the communities most in need. And so we're proud that we did consolidate a little bit and shut some of our smaller sites down, but we are, that was mostly to consolidate staff. We opened yesterday a brand new testing tent in a part of the city that we don't have a health center in. We're going to be opening another one probably next week. And so we have a lot of trying to really get to those communities who do not necessarily have testing access and don't have care. We also have been leveraging our partnerships. So we have a lot of community partnerships that do sort of social services and housing and other things. And we've been working with them on how to help them with different needs. We also, our social services team and our sexual reproductive health team have been great at sort of providing these wraparound services, as well as our youth center. So we've been doing a lot of this remote. We're still running our legal medical clinic all remotely. We're still running our employment and our GED programming. We are delivering food. We're partnering with our housing agency. We began also earlier this week to make sure that people still have access to sexual and reproductive health needs. So we have a system now where people do need to connect to free condoms or to other things, since we do so much work in there, that we will mail those out. We've also been, we have a very large sort of intimate partner violence program, and that because a lot of other agencies have shut down in Chicago, we've been taking on more of that, more disclosures, and sort of recognizing that during this time people are often quarantined with their abuser, and so we're doing a lot of support in that area as well. trying our best to avoid interruptions in care. So we have a COVID line as well that Dr. Corey Bloom, one of our physicians, has been kind of spearheading, and we have a number of providers and nurses who are taking that. That is not just for patients, it's for anyone in community who wants to call and ask questions and get kind of advice about that. We do have now 5, what we're calling community care stations or tents that are co-located at our clinic sites. And that is to sort of keep people who are symptomatic in the tent area, and then keep those that are coming in for in-person visits, which is very limited these days, but for certain procedures or certain needs or reasons they couldn't do telehealth. We've also been doing a lot of remote benefit navigation, and then also redeploying much of our staff, like I mentioned. We've also done a lot of fun things for staff. One of the things that I've been really proud of with our HR department and our behavioral health department, we have twice a week sort of self-care meetups. They're just Wednesday work breaks, we're calling them, and we switch up the topics. We also do a stress management group, which is twice a week that our behavioral health team does. We also have a Friday fun day where people can just sort of share on Zoom and connect. And I think a lot of our staff have really appreciated the FaceTime with staff because they're so used to work being a place where they socialize, they love their coworkers. We also have been doing some fun things like trying to take advantage and see some of the silver linings during this hard time where, you know, like a lot of health centers, we struggle sometimes with how fast things move or policies and procedures. And so we did a staff scavenger hunt to help people sort of, you know, look at our policies and procedures, look at the handbook, but also look at our social media website and do some of that, and then had some fun prizes also in that area. So it's just some ideas of things we've done that have tried to make things fun as well. Next slide. And then I'm going to turn it over to Dr. Holberg to focus on what we've been doing with our clinical work. Thank you.
Sure. So we recognized the urgency around being responsive on the phone to patients. So one of the cornerstones of our patient approach has been to try to support patients sheltering in place and recognizing the fact that if they were going to have trouble getting in to talk to someone or talk to a nurse or talk to a provider, that they were more likely to come in and walk in or try to access services in person, particularly if they were ill. So the phone triage became a much bigger priority than it had been before. So we set up a new system to take triage calls, and a whole team of nursing was really made working from home and handling calls that come in. And so initially when this all happened, much like I'm sure every other health center, we were getting calls like every couple of minutes. And so it became very difficult to keep up unless we could spread some of those calls around to so that we could respond to them in a timely way. And this seems to have resulted in a lot of good telephonic triage that has avoided in-person visits that probably weren't necessary and or would expose patients to the risk of coming into the clinic. Telemedicine, so we moved many of our providers to telemedicine and are switching those providers off in-person clinic duty and to telemedicine in 2-week slots, much like I think a lot of folks are doing right now. So far the providers have completed 670 telehealth video visits, much like what I'm hearing from other health centers, it sounds like, is that our no-show rate is much lower with telehealth. Patients certainly appreciate it. We're still offering in-person visits for complaints and concerns that can't be handled otherwise. So there's still a way to see a provider in person. So as people triage on the phone or telehealth providers establish that the person needs to see somebody for an examination, they're able to put it in with a provider that's actually physically in the clinic. Next slide. Our community care tents they serve 2 functions or maybe multiple functions at this point. So much like many health centers, we're doing symptom screening at the door. So we have a greeter that completes a symptom inventory or risk inventory with anybody coming in for any reason. And if they do have risk or contact with individuals that are confirmed COVID positive, or if they have concerning upper respiratory symptoms, then they are sent to the community care tent for testing. And so we've been able to mobilize that pretty quickly. The tent format has been able to keep the inside the clinic safer for both staff and patients, and has allowed us to expand a lot of our testing capacity. So far we've probably done about 700 tests. And of this, about 20% positivity rate for COVID. So of course that's, we know that there is extensive community spread, and that has been ongoing. So in our locations, there's many underserved populations. So we have locations across the city in Chicago, and we're probably offering an extensive amount of screening on the south side. Next slide. Another thing that we really recognized early on, or we're trying to grapple with early on, is mental health concerns that both our staff and our patients are experiencing. So we have our behavioral health department has created a couple of different formats for this. One is a self-check-in, which is basically like a group mindfulness activity that is a one-way communication. So it's basically broadcast. So you can join, and you have complete anonymity, and this is offered to both staff and patients. Recorded exercises, so there's some exercises for behavioral health skills that are recorded and can be accessed on demand. Next slide. And then they created a number of different virtual mental health groups. So relatively quickly. So while the behavioral health department went completely virtual very early on, that happened probably within a few days. They were able to continue with their clients. Most clients were able to be well served over either over the telephone or over telemedicine. And then the creation of the mental health groups is an attempt to engage patients in care. So these are a number of different themes that came up. So the support, a support group around managing change in general, or coping with COVID. So people who have COVID-specific concerns or stressors, parents and caregivers, which is and then other things really focused on coping skills and building coping skills and community in this new kind of virtual behavioral health space. Some groups that are under development right now is one for people who have lost work due to COVID or economically impacted due to COVID. And then for many of our gender diverse patients or who are not able to access surgery for gender affirming surgery at this point because all surgeries have been suspended, we're planning a support group for that. And then I think that's the end for us. I'll pass it on.
Great. Thank you very much, Dr. Holberg and Kristen. That is great information, and we really appreciate all the efforts that you and Howard Brown Health are doing in Chicago. It's fantastic. So if we advance the slides, we have another of our polling questions, and hopefully you can get out your phones again. And our next polling question is, and if you type in to the two-line 22333 and text in COVID-19 Heroes, you will to access our online polling live right here. And the question is, what operational changes have occurred at your health center in response to COVID-19? You may select more than one. All you have to do is in the same message line, you could put in A, B, C, D, and E, or you could put in different variations of them. You don't have to put them in separately. You could put in all as one response. So we're seeing all kinds of data coming in for hours of operation changes, location of care closure changes, reallocation or repurpose of staff, furloughs, and staff pay reductions. You can select all that apply, and you can put this all in to that message line, and our polling function will pick up all of those responses. We'll give it another 10 or 15 seconds more as we're getting a lot of responses coming in. And just to let people know, if you want to put in questions in the chat for our panelists, please do. We probably will not have time to answer them on today's webinar. However, we will be collecting all of those questions and then sending them to each speaker panelist to get those responses. We will package up those responses in a single document of frequently asked questions from today's webinar 4 on workforce, and then we'll be emailing those out to all participants on today's call. So it looks like we'll close the poll. However, it looks like 23% of health centers have had some hours of operation changes. 18% has had location of care closures. 31% of health centers said they've done reallocation or repurposing of staff. 14% of health centers have had furloughs, and 14% of health centers have had a staff pay reduction. So thank you very much for our live interactive poll. Next, we're going to turn it over to a close colleague of ours, Dr. Day, from Family Care Health Centers in St. Louis. Dr. Day, are you with us?
I am. Can
Great.
you hear me?
Take it away. Yes, we can.
All right. So I will highlight what's different from what you've already heard, because a lot of the things that have been mentioned we are doing, and this just shows a quick visual that's, I'm sure, what you all have been experiencing is these quick changes, really pushing our staff to be maximally flexible. So next slide. So we have focused a lot on staffing, really trying to put our staff first. Like the other 3 centers presented, we've had guided leadership with go-to meetings 3 times a week, where we go over announcements, input, and problem solving. We try to address needs around staffing schedules, travel, social distancing assessments, PPE, testing, and frequently asked questions. Like the other centers have highlighted, we needed to take quick action to allow for social distancing, developing schedules of rotation of in the office and working remotely. And mostly that's been done by our nursing staff, those in referrals, operations, and providers. We have really been focused on PPE and really have struggled actually to make sure that we maintain enough. And of course, like everyone, the rules of what PPE has been used is changing over time. Initially, we weren't letting people wear masks. Now we designate 1 mask per staff per day. And we, started doing the temperature checks with any manager who has questions about their staff, really consulting with me, working with our local Department of Public Health or the CDC to figure out how best to handle this. For us, and probably many of you, this all hit at the same time that people were traveling for spring break and having a variety of family exposures, so really handled those on a case-to-case basis. Really been working hard to do reassurance and communication. Our staff have been very much struggling with, is their job protected? How do we handle the fact that we're not seeing as many patients? And, many eager to do new things and stepping up to the plate to work together in new roles. We do have a trauma-informed care work group, and they have been working and continue to work on what we can offer to staff and patient support. All of these staff coming first is in light of, I just put to the left side of the slide where we're at in how our 20,000 patients have currently been affected. We still are waiting for what is felt to be the upcoming surge in St. Louis. So we've had only 11 patients test positive, 10 negative. Unfortunately, I'm jealous when I hear these other centers that have 700 tests. We were allocated 60 tests, and we've been very judicious in how we're using them. Luckily, they're about 10 drive-through testing sites offered throughout the St. Louis area. So we're mostly sending our patients who have the means to get tested elsewhere. But unfortunately, even those testing centers in St. Louis have really been limiting who they're able to test because they don't have enough tests. So we've have this bucket that we call presumptive positive, and we have about 24 of those, and those are usually patients who have symptoms that are highly suggestive, but just can't get a test. We currently have 50 tests pending, so you can see that, you know, luckily at this point, we feel like we only have 50 patients who have been directly affected, but I'm sure that's about to expand dramatically. Next slide. So our patient needs, much like other folks have spoken of, is, you know, a lot, increasing number of patients who are calling our triage. So we have nurses that are constantly on the phone answering those questions. We've really had to have providers who are seeing less patients jump in and help handle those triage phone calls because it's just often a bit of an overload. We've been sending out messages on our website through our appointment reminder system called Solution Reach to strongly encourage patients not to come in. We've never allowed walk-ins, but our patient population often do kind of put their voice in their feet and come to us. So we've really had to work hard to re-educate our patients about calling us. A lot of reasons why patients walk in is that we have a large number of folks that need translation. So really thinking about how to operationalize our staff who are providing translation services. We've noticed we've used agencies that we contract with to do translation, and as the whole city has been, you know, increasing demand of their services, it's been more clunky to use their services because even though we have iPads to do it virtually, they're not having the capacity of their staff, and so we're often doing a lot more of those translation connections through the agencies using phone. A lot of our patients have been stuck on quarantine, and luckily our community health team has come to the rescue. We've had patients who, again, have been told presumptively they're positive, go home and quarantine, but they're given medications, and our community health team is working with our pharmacy to pick up those prescriptions and deliver them to the door with a phone call saying it's there so that there isn't any contact for our staff to be exposed. We've done a lot of help with our patients in new circumstances where they've lost their jobs, they're struggling with food and other supply needs, and our community health team has really stepped up to be helping to figure out the resources in St. Louis to address that. As many of you have mentioned, stresses of COVID impact have been thankfully very well addressed by our behavioral health team, doing same-day telehealth visits with patients kind of after the provider gets off the phone and uses Skype to notify our BH that this patient's at home and needing some help. It's obviously a different flow of same-day care, but it is the baton pass off using that Skype interaction. We do have patients that come to the building. It's a very small number, but it's again around injections, prenatal care. We do some of the prenatal care in person. Often, like the new OB appointment is done mostly via telehealth, and then a much briefer visit in the building for the labs and other checks. We're prioritizing our children less than 2 for in-person visits to keep the vaccines going, and our lab is still open because a lot of the telehealth visits, you still need to actually get labs to know the status of, say, their diabetes. So as far as our overall clinical operation changes, they're kind of 5 categories of where we're challenged and trying to meet that. One is around PPE inventory, again, tracking all possible resources, using the supplies we have judiciously. One of our OB providers has been gathering the gowns that are in the packs for surgery and never touched, and horrifyingly enough, those were being thrown away. And he's like, if they've never been used and they're part of a surgical pack, he's basically collecting them and bringing them to us. We have been doing the screening at the door, but trying to figure out how to communicate to our patients, limiting who comes to our building, come alone, come with one other person if you have to have someone, and trying to keep the protocols in action of who's manning the door and keeping them educated. I'm sure you all have had schedule changes that just keep changing. You know, there's one flavor today and then we change it because we're changing building hours and that kind of thing. So just trying to standardize the approach of how we're doing that scheduling, how we're modifying schedules, how we're handling the patient flow tracking. I'm guessing a number of you have had the same challenge. If the person's not coming to the building, how do you use patient flow tracking in a way that makes sense, and helping providers to understand the needs to follow that, as opposed to just opening up an encounter and billing out of it so that we can capture everything properly. I'm sure that there's a discussion that centers that use patient flow tracking could have together to figure out what tips and tricks to share around that, but that's certainly been a challenge. I mentioned before our testing options and the challenge that we have there, really developing protocols so that everyone's working on the same page as far as who we're testing and why, with our limited tests. And, you know, unfortunately, part of the reason we are limited both in our testing and how much testing we're doing is the challenge with PPE. One other thing that I'm bringing up, which I think is different than what I've heard so far, is our interaction with our stakeholders. We have been asked by our City of St. Louis Department of Health to report out daily how many people have symptoms, how many people we're testing, and we discovered that our definition is different from theirs, and it's actually a little bit problematic because we realized that, you know, if they're reporting the numbers and have different definitions, that's kind of tricky for us. For example, you know, presumptive positive with limited testing in St. Louis, our definition has been patients who are instructed to quarantine because of high risk, but they can't get a test. When public health asked us to define it, they consider presumptive positive somebody who's had a test from a lab other than the state lab, i.e. Quest and LabCorp. In other words, they weren't necessarily considering those positive because they didn't have what was considered an FDA approved test. And so obviously those two different definitions lead us to think the numbers they're publishing are potentially quite confusing to the St. Louis area. Confirmed positives for us is anyone who's had a positive test resulting from any lab, and the City of St. Louis is defining it as a positive test from the state lab. And then patients under investigation, for us, it's really anyone who has symptoms of COVID. And for the City of St. Louis, it's when the tests are pending. So we think that the issue in St. Louis is probably much larger than the numbers that are being published, but thankfully St. Louis has recently pulled together a Metro Pandemic Response Team, and that is good in that we have community health centers represented in that panel, particularly to look out, because as many places we feel our patients are being more hit by the pandemic than patients in general, and we want to protect our patients as much as we can, get out the social messaging. I think there are pockets of St. Louis where they really haven't, despite the stay-at-home order, been following it as well as possible, and we want to get more preventive action out there for our patients to take part in. And then finally, I haven't mentioned, but all of you have gone into deep depth about it. We are doing telehealth. We converted as many appointments that are on our books to telehealth to maximize connection with patients. I've been surprised at how many patients I reach out to who say, no, you don't need to bother to call me. And then in the midst of the call, you know, we discover that their blood pressure has been 180 over 108. And they don't see a need to be doing something today about it, but obviously there are things that can be done. So it's a matter of continuing to educate our patients that yes, you need to stay at home, but we can be doing things to really maximize the status of your health, even in the circumstances you're in. And I think that's the last of my slide.
Great, that was fantastic, Dr. Day. We really appreciate all the work that you and Family Care are doing in St. Louis, and we wish the best. It's very interesting, actually, this definition situation. So thank you very much.
And actually, there's one last thing that wasn't on my slides that I wanted to announce. So luckily, our CFO is currently the superhero of the week because he did put in the payroll application, and whereas we initially had to make the painful announcement that we were going to have everyone take a 25% cut in their pay rate because we were approved for that funding, we now are obligated to make sure that everyone is paid to their full FTE, and we cannot do any reduction in, that payroll that we're offering people. So we're very excited that that went through and that we can continue to strive to keep our revenue coming in and our staff as fully functional as possible.
Well, that is great news, and I'm sure you're all giving Mr. Cruzy a big hug today. So that's fantastic. So next, we're going to hear from our colleagues at the National Association of Community Health Centers and Coleman Associates. But I just want to be mindful that we at Health Choice Network and Alliance Chicago together have over 120 health centers participating in this collective two-network project for webinar series. So with that, we want to then definitely turn to our national partners, the National Association of Community Health Centers, to talk with us specifically about some resources that we thought were very helpful for community health centers. So I think, Gina, are you on the phone first?
I am, Dr. Long. Can you hear me?
Yes, perfectly.
Great. Well, thank you so much for inviting the National Association to be with you today. I want to thank both Health Center Controlled Networks for convening this webinar series. I think more and more as we're isolated from one another, coming together to share and learn from one another is so important. On behalf of the National Association, I cannot shout out a big enough thank you to all the health center staff that are on today's call. Your care and your service to your patients, your community, and your coworkers is outstanding. Thank you for all that you're doing. The National Association wants you to know you're not alone, that we're working to amplify your voice in three major ways. The first is we are very actively advocating and raising awareness about community health centers' important role, not only in pandemic response, but in the continuation of primary care services for your patient population. We are also working across private partners, legislators, and federal agencies to raise your most pressing concerns and needs, some of which have been expressed today around PPE, technology assistance, emergency financial and payroll assistance, and longer-term revenue stabilization. Hearing from you, your primary care associations, and your health center controlled networks helps us be best informed to serve as your voice. And then finally, we're doing our best to address specific questions and requests that have come in from around the country for sample policies, procedures, guidances, and workflows specific to the current health center operating environment, which I think is what leads us to highlighting today's resource, which is a result of an amalgamation of many health centers sharing, like our speakers today, what's working for them in their health center setting. I'm so pleased that we've been working with Coleman Associates to help put forth some resource packets, and today I'm joined by Amanda Laramie, Chief Operating Officer and primary author for the document she'll be walking you through, entitled Reduced Workflows and Staffing Guidance for Non-Clinical Operations. I should note that we've recently posted an accompanying remote work toolkit to go along with this as well. So Amanda, over to you.
Thanks, Gina. You can hear me okay?
Yes, we can.
Great. Okay, awesome. So yeah, if we can just go to the next slide, I can walk through this tool that Gina just introduced. Thank you so much, Gina. And it's been great to hear from the other health centers who are on this webinar. We did, like Gina said, speak to a number of health centers around the country regarding their particular situations when it comes to responding to COVID-19. And what we did is we created what we think is a helpful informational packet that has it starts with a self-assessment, basically. So the screen you're looking at has health center hour of operation considerations, and then it has a place for you as health center administrators to look through and check what is your current situation. Because we know that every health center is having different and nuanced approaches to responding to the coronavirus pandemic. So for example, you would start this and go through the self-assessment. You would check items that pertain to you, like if your demand is consistently high. Some health centers we've spoken to have a really high demand. Some are in an opposite scenario where their demand is really low. Some are in the situation, and we've heard it on this call, where staffing levels are becoming difficult to afford, and you're going to have to make different decisions regarding staffing. So essentially, you would start with this self-assessment and then be guided to one of or many 7 situations that have best practices connected to them. So for example, yes, in the next slide, you have the 7 options. So whether you have high patient volumes, how to respond to that. If you need to increase testing capacity, what are the best practices for that, as well as how to start moving administrative staff to remote work. Next slide. And then we have a decision-making tree to help you decide how to deploy staff to work remotely. So how patient-facing your staff are, when you can move them remotely, what would be a good way to keep them interacting with the rest of your staff. This tool is also available in the toolkit. Next slide. And then there's some of the difficult questions we were asked when we were putting this together is, how do you make decisions around when to lay off, furlough staff, and what are some different strategies? So we have some best tips in here, like, first of all, defining the difference between furlough and layoff, just because those are getting tricky in this day and age about what furlough is and what the unemployment guidelines are regarding that, as well as thinking about how to best communicate with your staff regarding these decisions. One of the best practices we've known from working with health centers who've had financial struggles long before this is best practices for how to communicate that to the staff so there isn't a feeling of confusion or fear or not knowing what's happening, and how to bring them into some of the decisions and share what's happening as well as a timeline. That is also available in this toolkit. And the one thing I'll also mention before I move on to the next slide is that we heard earlier in the webinar from our friends in North Carolina talking about some trepidation that some providers were having moving to telehealth when they can't touch patients. So another resource that could be available for you if you do listen to podcasts is our Healthcare Innovation podcast by Coleman, because we recorded an interview with 4 physicians who are doing telehealth and what their best tips are when it comes to conducting physicals over the phone, or how to provide this longer term telehealth care so it's not just a Band-Aid. So that's a resource to you as well, I just wanted to mention. And then the last slide is just an example schedule that we put in the toolkit that shares if you are furloughing staff and have to rotate them through, respiratory clinics or your well clinics, an example of how you could do that so you could minimize exposure for staff, but also make sure that you're thinking about the financial viability of the organization and that you may have to furlough some staff to keep your doors open. So that is all in the toolkit, and I know it's linked in this webinar under handouts, and I also know that it's available through NAC as well.
So great. Thank you very much, Gina and Amanda. Your toolkit that you put together is fantastic. You are correct. It is on today's webinar on the right-hand side under the handouts, and individuals can download that. We also can email that out to individuals. You can also get it from the NAC website where we got it from. We want to thank you for participating in that. On this slide here is just some COVID-19 resources. We found these to be extremely helpful. The slide is put together by NAC, and we found it all of these resources to be very useful. So Gina, anything else that you wanted to comment on from NAC's perspective?
Well, I just wanted to express thanks again and encourage everyone on the phone to take care of yourself as best you can. We're going to need you on the other side, and your resiliency is appreciated. Do check out some of our other tightly curated resources. We're trying not to overload folks, but to be very targeted. We have a fraud schemes alert, a strategic national stockpile and local supply chain coordination tip sheet, and we have some drive-through clinic sample policies and procedures for those that still need it. Thank you, Dr. Long, for the opportunity, and great job to everyone. Hang in there.
Great. Thank you very much, Gina and NAC. And in addition to NAC's resources, which are fantastic, both Health Choice Network and Alliance Chicago have put together a library of resources. You can take your phone and scan either or both of these, and it'll take you directly to that resource library, or you can download the slides from today's presentation and hyperlink the blue items on there and take you right to those resource libraries. Before we end today's webinar, we definitely want you to participate in our live interaction. And make sure you get your phones out again and type in the one word we'd like you to share that rocks about your health center workforce. So in one word, share with us what rocks about your health center workforce. So this word cloud we put together in real time as individuals. We have over 250 individuals on today's call who are participating in live demonstration of the work that our health center workforce is doing now. We will put together all of the questions that were asked during today's webinar into an FAQ document, which we will make available. We will email that out. We additionally will put together all of the slides that is available if you did not get them from the webinar. We anticipate having weekly webinars on a number of topics, both at Health Choice Network and Alliance Chicago hosted. If you have items, let us know. And we hope everyone has a great day. We will be putting out this word cloud in the summary of today's webinar. So as we close, we'll just look at the words of our excellent health center workforce. We thank you for all the work that you do, and Health Choice Network and Alliance Chicago appreciates all of the federally qualified community health centers across the country that are participating in our health center controlled networks. I hope everybody has a great day, and please stay healthy. Smile. Bye.